Angeline with San Juan Basin Public Health here in Southwest Colorado with our last weekly update of February 2021. We are coming up on the 1-year anniversary of San Juan Basin Public Health's response to COVID-19, and for this week's update we're going to focus on some new information about vaccines. So the first thing we want to say is that vaccine supply is still limited across Colorado and across the country. We do not have enough vaccines to get to everybody. But Colorado is anticipating an increase in supply in March and April. So with that information, Colorado today announced expanded phases for who is eligible for vaccine next. We are currently in phase 1B2 in the state of Colorado, and in March 5th, we're going to open up for 1B3. 1B3 is going to be anyone over the age of 60, and it's also going to be 16 to 59-year-olds with 2 chronic conditions that are listed on our website and listed on SJBPH's website. The other individuals that are added in to 1B3 are grocery store workers, agricultural workers, and other specific industries of individuals who, due to their work nature, are in high exposure, have contact with the public, and need the vaccine now to be able to be kept safe as we're moving through the vaccines. So the goal for Colorado, after Colorado opens 1B3 in the beginning of March, is then by the end of March to move into 1B4, which is really a huge expansion of who's eligible. 1B4 adds in everybody who's over the age of 50 and adds in lots of essential frontline workers. It includes everything from faith leaders to folks who work in public transportation, to individuals who work in human services, to restaurant workers, to people who are working in higher ed. So there's a big list. We really encourage you to check our website, both for the chronic conditions in 1B3 that make people eligible if they're between the ages of 16 and 64, and for all of the professions and workplaces that become eligible later in March for 1B4. So with this, we're going to need a large expansion of supply of vaccine. We're getting good news that new vaccines are being approved and will be brought into communities in the next couple of weeks. We are working behind the scenes with lots of providers, community groups, fantastic community volunteers to increase access across the 2 counties served by San Juan Basin Public Health. So lots of things happening. We're increasing who's eligible in the phases. We're hearing that more supply is coming, and we're working as a community to increase the access so when this supply comes and more people are eligible, we're ready to go as a community. Thank you for your patience. We really wish that as soon as a phase got opened, everybody who was in that phase could get a vaccine right away. What we're hearing from the state is to expect as a phase opens, most people in that phase can expect to have access to a vaccine in about 6 weeks from when that phase opens. We've experienced this here locally with earlier phases. In 1B, Colorado initially set out the goal to have 70% of 70-year-olds with opportunity for vaccination by the end of February. We were the first region in the state to reach this goal. So we know that as these phases get released, as supply increases, and as more providers get involved, and we have such an outpouring of interest in getting this done, we know that as phases open, we can pull together as a community and move through the phases. The thing we have to really remember right now, though, is that vaccine is not what is controlling disease. We really need to work together to still keep our case count low, following the protocols that we've all gotten familiar with over the last year, going into the next couple of months while we're still getting vaccine out, and we're carefully watching whether or not we will continue to decrease cases as well as we've been doing, or if we're going to start to plateau and potentially have some challenges with variants. So with that, we're asking you, please come get a test if you're symptomatic, get a test if you've learned that you've been exposed, and follow the protocols. And keep an eye on when you are eligible for a vaccine, and please join us when you can get your vaccine. Thank you.